Welcome to the SmileLine podcast. The purpose of this podcast is to give real information from doctors and patients about our SmileLine prosthetic and the sequence of appointments. For more information, check out our website or give our office a call. Hope you enjoy today's episode. All right, guys, welcome back to the SmileLine podcast. I am here today with one of our main dental assistants in the general clinic, Hanna Kremer.
The one and only.
That's right, the one and only. So thank you, Hanna, for joining the podcast. We're doing this new series. We've had Abby on, and now we have Hanna. So it's a get to know. I'm going to ask Hanna some hard-hitting questions, and we're going to learn a little about Hanna.
All right.
So tell me about yourself, Hanna. Where are you from?
I am from Loose Creek, so I grew up around here in Westphalia. I was seen by Sam's dad, Tim, a little bit growing up. I went to Fatima High School, then went to State Tech for dental assisting, and now I am at Huntline.
Gotcha. What made you pick dental assisting program?
So growing up, honestly, when I was younger, I never went to the dentist, which is surprising, but my dad was always one of those people that hated the dentist, had a bad experience, wouldn't.
So naturally you went and worked for a dentist, right?
Exactly. But he didn't want to put his kids through that type of experience that he went through. So growing up, I never really went to the dentist as a kid. Once I turned 16, was able to drive, get my first car, is when I started going to the dentist. Back when I was about 17, I had a traumatic accident. I had passed out in Route 21 and busted out my front teeth, so I had to go to the dentist. I was terrified because of all the stories that my dad told me. I was scared to go, so we had made an appointment with Tim. I went in, and he had fixed my teeth, and I've had the same teeth since, and I've loved them. And then that's kind of what opened my eye to dental assisting. And from there, I've always liked the straightening aspect of dentistry. I thought I was going to be an orthodontist assistant at first.
Yeah.
So then I went and I shadowed Tim. From the shadowing, I had got a job offer, worked for Tim for a little bit, and then I decided that I wanted to go to school. So then I went to school and focused on my studies, and then
Focused on those studies, huh?
Graduated with dental assisting.
Wow.
Degree.
So backing up there, I did not know that previous story. So Dr. Tim, which is Dr. Sam's dad, he's been a pretty integral part, right?
Yeah.
Like from the beginning stages of going in. And you say you had a car wreck then? Is that...
I had passed out in Route 21. So I was shopping with a friend. I passed out, face planted on the concrete. Completely busted out my front two teeth.
Oh my gosh.
I told my dad, I was like, I'm not going back to school until I get these fixed.
Yeah.
So we had made an appointment that, I think it was a Friday.
So Dr. Tim seen you and you were kind of like, well, this is cool. And then you job shadowed him, right?
Yep.
And did you job shadow the ortho place as well?
I did not. So going through the dental assisting program, we had done our expanded functions, and one of them was ortho. And that is what made me never want to touch an orthodontic band again.
Yep.
I hated ortho. I realized that, like, from a typodont where we're learning on the typodont, it's fake teeth, and it's not as good as, like, a real tooth. But it was very stressful watching the bands and everything like that pop off and still trying to pass.
I bet so. I bet so. How was Lynn State as a program? Because Lynn State's pretty big around here. Like a lot of kids go to it. What do you think of the dental assisting program?
I really like it. So when I was working for Tim, I was always stressed out because there's so many instruments, certain names for each one.
I know like 3. There's so many.
There's
and I had no
so
idea
many.
What they are.
I knew nothing. So going to Lynn State Tech for the dental assisting program, it helped me learn absolutely all of those. At first, I thought I wasn't doing as good in the field of dental assisting until I got all the feedbacks that I did from offices that I went to. Like, I know that Brooke had said some good things about
our
me.
office?
Yes.
Me too, right?
And then, yes. But overall, it had helped me get to know all those instruments, open my knowledge to all that, and then as well as get my CDA and my expanded functions on my back.
Gotcha. So going through dental school, you have three clinical rotations.
Mm-hmm.
Did we see you for two of those, your first and your third? Is that right?
You saw me for my second and my last one.
Second, your last one. Where'd you go first?
I went to Gasson and Jeff.
Gotcha. Okay. So how was the experience there at their office?
So that was my very first rotation. Like any other student, I was very nervous, scared. Mm-hmm. A lot of the things that he does in his practice, he does it more himself. So the scanning, everything like that, he'll take care of all of that himself. Whereas at Huntline, Sam and Maddie want you to do it all. Like the least that they have to be in that appointment, the better. Mm-hmm. So that's what I like about Huntline. It opens me up to a lot more that I get to do.
Yeah, and I think that's pretty common. I think most offices, the dentist tries to do the majority of it or stay in control, where at Huntline, like, you have all these skills that you went to school for, and it's like, hey, why not use them? That's what you went to school for.
Yes, and I also think that just opens up more columns for other patients to come in as a workflow and be able to see more patients in a day.
Absolutely. So we seen you for the second and third rotation, and I remember like during your second rotation, we were looking for people to hire, mm-hmm. and so I called Lynn State and I was like, hey, like, what do I got to do to keep our students here? And your teacher's like, well, you just kind of got to offer them a job, and then I can keep them there. And I was like, okay, well, I'm gonna do that. So yeah, you went straight into second rotation, third rotation, and really that's just a compliment to you, because we seen your work ethic and what you did your second rotation, and it was like, hey, what do we got to do to lock her up?
Yes, and honestly, I think it was it 2 or 3 weeks in, you had came up to me on my second rotation. It was the first time I was at Huntline, and you were like, do you feel comfortable running a column by yourself? Mm-hmm. And it was in hygiene, and I was like, yeah, sure, throw me in. Let's do it.
Was that a lie?
At first I was nervous, but I knew I could handle it. I never show that I'm ever nervous.
Yeah.
I always just jump in, do it, get it done, mm-hmm. and then it usually goes as planned.
And the only reason we asked you is because we thought you could too. Like,
yeah.
It was like, hey, like, we think Hanna can come in, run a column by herself on your second rotation and be just fine. So it was like, hey, as long as she feels comfortable, we're going to start running it that way. Yeah, so great. So what do you like most about Huntline? Anything that sticks out?
I honestly love working with Dr. Maddie. So throughout clinicals, I worked with Dr. Sam. Mm-hmm. I really got to know his workflow and how he did things, which Dr. Maddie and Dr. Sam are two completely different people. Sam uses more of an indirect vision, so you're more of watching his head so you don't run into it. And Maddie's more of a indirect vision. So
I have no idea what that means. Just FYI.
So indirect's more of like using the mirror to see in the mouth, whereas Sam just usually bends over. He likes to see it directly.
Gotcha. So you gotta watch out so he doesn't headbutt you.
Yes, he hates that. I would say that's probably a big pet peeve of his. I mean, if you headbutt him, Chris, and he looks at you, you know. Like,
I've gotten those looks before.
Yeah.
He's never headbutted me, but I get those looks.
Yeah, but they're two completely different people to work for. So going through clinicals, at first, it was rough. Me and Maddie had a patch. I couldn't figure out how to assist her correctly, mm-hmm. And feel like I was being beneficial for her. But me and Maddie now have a great workflow.
Yeah. Is it fair to say, like, you and the assistants and the doctor get into this relationship where you guys communicate without talking,
oh,
right?
Yeah.
Like,
yeah.
You know what the other one's thinking, they know what you're thinking, and it's just seamless, right?
Yeah. One of my favorite things, actually, is so I'm Dr. Maddie's maid assistant now, so whenever somebody else that's assisting her doesn't catch on to a cue, mm-hmm. she'll make sure to bring it up at like lunch or something and be like, Hanna, what does this mean? And then I'll say it, and then the other assistant will be like, okay, I messed up one time. Yep. But yeah, you catch on to those cues quite a bit.
Absolutely. And so what would you say your favorite dental procedure is to assist on?
My favorite dental procedure right now would either have to be the single implants or larger bridge preps.
Gotcha. Why is that?
I like the single implants just because there is so much going on. Like, you get to see the almost entire anatomy when doing it. The way the tissue gets flapped and stuff like that. It's just really interesting to watch, number one. And number two, it's pretty quick, honestly. Quick and painless. And then I would say that the bigger bridge preps are my favorite because, I mean, you're changing somebody's smile without pulling their teeth.
Definitely. Those results on the big bridge preps are usually pretty life-changing just awesome to see. It just makes you feel good, like, dang, we really nailed that one.
Definitely seeing the patients, like, happy about it at the end. I mean, that hits home.
They smile differently.
Yeah.
Like, whenever you fix them, they smile differently.
Yeah.
So back to, you were kind of saying when you were little, you didn't go to the dentist very much. Do you have any advice for younger people that are, like, thinking about making a dental appointment or nervous to go to the dentist? You got any advice for those patients?
I tell any patient that comes in and starts with talking about their bad experience as younger adults going to the dentist. Technology has changed. You can't force somebody to go, but once they get their foot in their door and give it that one appointment, that one chance, they realize that it's a completely different world now. If they're really nervous, like, that's something that's understandable, but I think just making a single appointment, especially with Huntline at least, I know that we do a good job explaining everything step by step when it comes to a nervous patient, explaining that to them.
It's not really anymore of hey, I got a toothache, well, grip and rip and tooth gone and you're out the door and in pain. Like, I feel like a lot of people think that way because it might have been that way, a while back, but things have changed.
Yeah, for sure.
Yeah. Okay, so are you ready for these hard-hitting questions I got coming up?
I guess.
All right. Let's see how you do. Okay. Are boneless chicken wings really just chicken nuggets in disguise?
No.
How so?
They taste different.
Okay, but they're still made of chicken and no bone in them, no wing?
But I think that chicken nuggets are more like processed.
All right. If you had to pick a superpower, what would it be?
Probably to fly. Honestly.
Why is that?
Because then I could go anywhere. I could just sneak up on anybody and just be there.
I love that answer, by the way. Mine has always been, like, I would just really want to fly. Yeah.
I would say fly or be invisible, but definitely fly first because I would want people to see me.
Mm-hmm. Do you have any siblings?
I do.
How many?
That's where it gets kind of complicated. I have 3 step-sisters. All right. Oh. I have 3 step-siblings, 2 half-siblings, and then 3 blood-related.
Okay. All right, yep.
So confusing. A big family.
Do you eat cereal?
Not really.
Okay, well then I'll skip that one. What's your favorite color?
Yellow.
Do aliens exist?
No. I don't know.
No?
I'm going to say no until I see one.
Okay. What about ghosts? Do you believe in ghosts?
Yes.
All right. Is there any in this room?
I don't feel any in this room. I may never come back if there was one.
All right. If you had to pick an animal to turn into, what would it be?
A pig.
Can I ask why?
I don't know. This is just, that's the first thing I think of. It's just, all right, okay. They do stink, though. I don't want to stink.
What's your favorite food? You better not say pig.
Probably anything pasta, honestly.
Pasta. I love pasta.
Never go wrong.
All right. What does Hannah's future look like?
I see myself being here.
Yeah?
In this town still, working for Huntline. Like I told you the other day, you guys will literally have to drag me out. Just kicking and crying. But I love Huntline. I'm probably just by myself, honestly.
Oh, gosh.
I love being alone. I'm very independent.
Okay. Well, yeah. What if it's what you want?
If it's what I want, I'd like to be married, but...
You're still really
I can settle for being alone.
I always just get blown away with how young some of the assistants are. I don't really consider myself that old yet, but then whenever you guys come in and you're like, yeah, I haven't celebrated my 5-year high school anniversary yet, and my next one's going to be 15, it's like, oh, man.
Mine will be this year.
Yeah.
This year.
All right, guys, there you have it. We know Hannah a whole lot better than we did before right now. Very interesting story. So thank you for coming on the podcast today.
Thank you.
Yep. So give Huntline a call, and if you're in the general clinic, it's very likely that you will see Hannah and the rest of the girls, and I promise they will take care of you.